your hands shake? Do you know anybody who has shaky hands? It can kind of be a scary thing. So let's talk about it. This is Dr. Parker at NeuroWorld-MD. Hello. Hey everybody. I am Dr. Parker Bohm. I am a neurologist. I did my residency training at the Mayo Clinic in Florida and my fellowship at Washington University in St. Louis. Today we're going to talk about 5 of the most common reasons why your hands may shake. So let's dive in. So to explain the first reason that your hands may shake, I need to explain an important concept, and that is something called physiologic tremor. Oh, and by the way, a tremor is just a fancy medical term that means some sort of involuntary rhythmic shaking movement. Okay, so do you see my hands shaking here? Okay, maybe you didn't see that, but watch this. You see that shaking now? So did you see my tremor? That is my physiologic tremor, or basically the tremor that all of us have. That's just kind of the normal way our body works, to have a small degree of tremor. But what happens if something brings that small degree of tremor out more? Well, that is something that we call enhanced physiologic tremor. Enhanced physiologic tremor is basically where the normal tremor that we all have gets brought out more by various factors that are temporary. So for instance, let's say you're just really nervous or anxious. You have some big event coming up later, or you have a test, or you have to do some public speaking. So your heart's pounding and you might have some more tremor. Or maybe you're really worried about something. That can bring out tremor too. Or maybe you just worked out and your muscles are pumped and the blood's just really flowing through your body. You might notice more tremor. Or maybe you're sleep deprived. That can bring on more tremor. Maybe you've had a lot of caffeine, so tea or coffee or soda. Or do you call it pop? I used to call it pop. And if your thyroid levels are off or something else is off within the body, that can definitely bring your tremor out more. I remember when I was in medical school going through my cardiology rotation, and I saw a young woman in her 20s whose heart rate was going way too fast, and she had really significant tremor as well. And what ended up happening with her is she was diagnosed with hyperthyroidism, so her thyroid levels were too high, and that was making her heart beat too fast and actually causing tremor. So that's reason number 1, enhanced physiologic tremor. So keep that in mind. Let's go on to reason number 2. So another common reason that people may have tremor is due to side effect of medication. A lot of people in the world are on prescription medications, and a lot of those prescription medications can cause side effect of shaking. So for instance, medications for anxiety or depression. About 16 to 17% of the people in the United States are on anxiety or depression medications, and a lot of those can cause tremor as a side effect. For instance, sertraline, or you may know that as Zoloft, that's a very commonly prescribed antidepressant. It's what's called an SSRI. I use that medication quite a bit. I think it can really help people. But in the FDA package insert, it lists tremor as a possible side effect. Actually, about 9% of patients in the pooled clinical trials did experience tremor as a side effect. And that's just one of the SSRIs out there. But it's not just medications for mood that can cause shaking or tremor. There are a lot of other medications as well. So when I'm seeing somebody in the clinic and they're coming in for shaking of the hands or tremor, I'm always looking through their medication list to try to figure out, are they on a medicine that might be causing it? So for instance, Depakote or valproic acid, that's a commonly used anti-seizure medicine, or sometimes it's used for bipolar disorder or other reasons. That can cause shaking. Amiodarone is a medicine that helps to control heart rhythm. That can cause shaking. A lot of medications for asthma or COPD can worsen tremor. There's a medication called tacrolimus, which is used in people who have had transplants to help suppress their immune system. That can certainly cause tremor. I see a fair amount of people who are on bupropion, which is a medication that can help with mood disorder, and that can cause tremor, or it can cause these little jerking movements called myoclonus, which basically can make you accidentally fling something or click something or tap something when you didn't mean to. If you've ever heard of prednisone, so that's a corticosteroid medication, that can certainly cause tremor. And then of course, thyroid medications themselves, trying to treat thyroid disorders, those can sometimes cause tremor as well. So don't forget about the possibility of a medication as a side effect causing hand shaking. Now, even if we prove that the medication is causing hand shaking, it doesn't necessarily mean that you need to stop that medicine. So figuring out with your healthcare provider the benefits and the possible risks of a medication is always a good thing. I see a lot of people where we end up figuring out that one of their medicines is causing a side effect, but the benefit of the medication might be worth it to stay on. So just because you're having some side effect, if it's mild and if it's not really bothering you that much and you have an answer for why you might be having some tremor, it might be worth staying on the medicine if it's helping out with something else. By the way, thank you so much for watching this video. I just posted my first video on this channel a few weeks ago at the time of this recording, so this is a super new channel. That being said, if you could drop a like, or if you want to follow me for more content, you can hit the subscribe button. That would be amazing, so thank you. So the third reason that you may have shaking hands is something that's called essential tremor. I see a ton of essential tremor in Neurology clinic. It's actually a very common movement disorder. It's estimated that about 7 million people in the United States have essential tremor, and it's more common as we get older. Some studies indicate that about 5% of people aged 65 or older do have essential tremor, but I also see a lot of people who have it at a lot younger age. So there's a very good chance that you have seen somebody who has essential tremor. This is the type of tremor that can classically cause hands shaking when somebody's holding something. So if you've ever been to a restaurant and seen somebody holding a glass and their hands just shaking, there's a high chance that that's something called essential tremor. Or if you have a waiter who's bringing you something and you just notice that their hands shaking quite a bit, that's likely called essential tremor. Essential tremor used to be known as what's called benign familial tremor, but they kind of got rid of that name for a couple of reasons. So one, it does not always run in families. Yes, oftentimes it does. Oftentimes people will say, oh yeah, my mom or dad or grandma or grandpa, they kind of had some of the shakes, especially when they got older. So it can run in families, but it does not have to run in families. And I've seen a lot of people who say, no, nobody in my family had any sort of shaking. And then second, even though it is benign in the fact that it won't kill somebody, it's not due to a serious, scary cause like some other disorders that we see in neurology, it can still be very debilitating for people and cause a lot of different day-to-day symptoms. There was actually somebody at my church a few months ago who had got up on stage and he was doing a Bible reading, and one of his hands started to shake. And I think what had happened is he realized that he was up on stage and his hand was shaking, and that made him more stressed out. So then both his hands really started shaking, and then they got very, very severe. And I mean, he had pretty high amplitude shaking, and I could tell he was quite embarrassed. I've also had patients who, were unable to write Christmas cards because their hand was shaking so much due to essential tremor. So even though it may not cause serious symptoms compared to some other things that we see in healthcare, it can still really affect quality of life and be a big problem for a lot of people. Fortunately, we have a lot of different medications that can help people who do have shaking of the hands due to essential tremor. Now, I will mention that I see some people who have what I would consider really bad essential tremor, and they don't want to be on medications at all. And then I actually have other patients who have very, very mild essential tremor, but they want to be on medicine. So it's kind of a individual decision I would encourage you guys to work with your healthcare providers to figure out if it's right for you. That being said, the medication used for essential tremor, it basically treats the symptoms. So it's not actually treating directly what's causing the tremor itself. Being on that medicine is not going to prevent the tremor from slowly getting worse over years and years and years, but it is something that while you're on it, you might notice a benefit. I actually have a patient who has competed in pistol tournaments, so shooting accuracy, and with him, he was on a kind of stable dose of a medication for tremor, but on the days he had competitions, he would take a slightly increased dose of his medication. So again, it's trying to figure out what works out best for you. And if medications aren't working and the tremor is severe and really affecting quality of life, there are some more invasive options. So there's something called focused ultrasound, or even something called deep brain stimulation, which is kind of like a pacemaker, but instead of going to the heart, it actually goes deep into the brain to affect the part of the brain that's actually causing the tremor. So those are more invasive options, but they could be the right option for somebody who's really having their quality of life affected by tremor. So for numbers 1 through 3, I was mainly talking about something called an action tremor. So an action tremor is basically a tremor that comes out when you're doing certain actions. So maybe holding your hands in a certain position, or holding something, or trying to touch something, or use a screwdriver, or try to scoop up soup or something like that. But we're going to be talking about what is called a rest tremor. And a rest tremor is just that. It's a tremor that comes out more at rest. So for instance, if I was talking to you right now and my hand over here was just kind of shaking off to the side, that would be very consistent with a rest tremor because I'm focused on talking. I'm distracted right now, but that's when my tremor would be coming out the most. That's an example of a rest tremor. Now, a rest tremor can certainly be concerning because it can be a symptom of something called Parkinson's disease. That's a fairly common problem that you might have heard of. Parkinson's disease is what we call a neurodegenerative disorder, a neurodegenerative movement disorder. So basically the neurons in the brain that are responsible for making dopamine, which is important for movement, are slowly dying off, and it can cause progressive symptoms over time. So Parkinson's disease can be associated with a lot of different symptoms, and oftentimes a tremor is one of those that's more of a rest tremor. But oftentimes it can also cause softening of the voice, it can cause shuffling of the feet, it can cause a feeling of muscle stiffness or muscle tightness, it can make people's handwriting slowly get smaller, it can cause slow response time, or slow movements when people are looking around or talking. So Parkinson's itself can cause a lot of symptoms. A lot of the ones I just listed are called motor symptoms or related to movement, but it can cause a lot of non-motor symptoms too, like constipation or sleep problems, like acting out dreams at night, punching, kicking, etc. Those can be something called REM sleep behavior disorder that can occur in Parkinson's. Now, when I see somebody in clinic who has a rest tremor, I'm doing an exam to try to figure out if there is any other evidence of anything else that looks like Parkinson's. And what I mean when I say that is I am looking on the exam for something called Parkinsonism. Parkinsonism is just kind of the umbrella and overall term for a variety of different signs that we can see and symptoms that people can have consistent with the brain not functioning right in a certain way where there's not enough dopamine. So like I had mentioned, softening of the voice, rest tremor, slowed movements, shuffling, stiffness when we check kind of their exam. Now, if somebody has Parkinsonism, yes, certainly they could have Parkinson's disease, but I'm always looking at their medication list to look and see if there's any other possible contributing factors. For instance, people who are on antipsychotic medications, those medications work by blocking dopamine. So it is effectively inducing like a Parkinsonian state in some people, which most time would go away if you would stop the medication. So somebody on really high doses of antipsychotics could literally look like they have Parkinson's. It doesn't mean they actually have Parkinson's. It might just all be side effect from a high dose of that medication. Now, it's very rare to have Parkinson's at a young age. The age of onset is most commonly around the age of 60, and then it gets increasingly more frequent as we get older. But that being said, if you have a mainly rest tremor to where, you're watching TV, or somebody who's just watching TV and off to the side, their arm's really shaking, and that seems out of proportion to the tremor that they're having in other times, it would definitely be a good idea to discuss this with your healthcare professional, just so you can try to figure out what's going on. Okay, number 5, we made it through. So the last one I will talk about is something that's called functional neurologic disorder, or FND, specifically causing tremor or functional tremor. So FND, or functional neurologic disorder, is a disorder that any neurologist who works in a clinic, who does outpatient neurology, sees a ton of. I've seen so many people who have FND. Now, FND is kind of a poorly understood disorder that we're starting to learn a lot more about, that can cause a variety of different symptoms. So people with FND could have shaking, they could have weakness, they could have just major numbness. So it can basically mimic pretty much any neurologic symptom. Some people with FND have what are called functional seizures, which look sometimes just like regular seizures, but it's not due to epilepsy, it's due to something else. So in FND, there's basically a problem with the connection between the brain and the rest of the body. And what I mean by that is the brain itself seems healthy and the body or the muscles seem healthy, but the connection between the two is not working right. And this is thought to be due to disruption of these networks of different neurons in our brain that are responsible for how we actually perceive things or how we actually move. So with FND, there are some risk factors I want to talk about. So one is history of anxiety, depression, mood disorder. 2, and this is a major one, I always bring this up with patients, and I mean, obviously this is very serious, but some sort of history of abuse, whether that's been physical, emotional, sexual abuse, that can be a very strong risk factor for FND. Weirdly enough, joint hypermobility, so things like being majorly double jointed and things like that, that's a risk factor for FND. But some people don't have any of those risk factors. I've actually seen physicians and I've seen CEOs who have functional neurologic disorder. So it's something that can affect a wide variety of people. And this is something that sometimes in conversations between doctors and patients somehow get the idea, and maybe because it was explained like this disorder is in their heads or made up or something like that. And it is by definition not a made up disorder. Now, in terms of in their heads, I always make the joke, most things that I see in neurology are in our heads, because our brain at the end of the day is responsible for a lot of the different problems that we see in neurology. But no, it's not in your head in that kind of way, I guess. It really is a very real problem, and unfortunately does cause a lot of fear and frustration for a lot of patients. A lot of patients just feel lost in the healthcare system because they're not really getting very many answers, and FND is oftentimes not described properly as an actual answer to what could be happening. Now, one caveat for basically this whole video is stress can pretty much worsen anything in medicine and anything in neurology. So if somebody has a tremor due to whatever reason, there is a very high chance that stress is going to worsen that tremor. Actually, if people have cognitive issues, brain fog, or if they have weakness or numbness or pain, there's a very high chance that stress is going to worsen those symptoms. That does not mean it's the cause of their symptoms. So thank you guys so much for tuning in. I could have gone in a lot more depth in this video about each of these specific topics, but I wanted to make a video that would be a resource for people who are maybe experiencing some things like this, just to help them have some sort of idea of what things to think about or what to consider. So in the future, I think there's a very good chance that I'll be making individual videos for each of some of these conditions, and at some point I can link those at the end. So if you're interested in something like that, again, it would be amazing if you could like this video or subscribe to the channel. That just helps me know that there's some support for this endeavor in this channel itself, because obviously it does take time to produce these videos and edit them and everything like that. But again, thanks for watching. As a reminder, if you're having medical concerns, you can always go talk to your healthcare provider. But anyway, hope you can get outside for a little bit today, go enjoy the weather or get a little bit of exercise. And don't forget, you are amazing. There is literally nobody else in the world that's like you. So you're awesome. Have a good rest of your day. Peace.